This is my current mobility routine as a 44-year-old female that has thoracic and hip pain. So this is me doing what is called thoracic CARs, which is controlled articular rotations. And thoracic CARs are similar to the yoga pose that you recognize, but what I am doing is trying to go segment by segment, starting at the top, working my way down, trying to gain segmental control. And there are areas where I am exceptionally stiff, like my upper thoracic. So I struggle to get that flexion. Here I am doing the opposite direction. And as I get lower in that segmental control, I draw in my transversus abdominis, and now I'm going to sink into child's pose and really stretch my thoracic spine. This here, thread the needle, I am doing to help gain rotation in my upper thoracic. If you have pain between your shoulder blades, this particular thread the needle exercise will help you mobilize your own thoracic spine. So this is an example of what a mobility routine looks like. And this is actually in real time. This is me doing hip CARs. Once again, CARs are controlled articular rotation, and I am going through this particular range, and notice I'm a little shaky towards the end because I have stiffness, and because I have a limited range, I also have weakness. Also notice the position of my foot. I am on my toe because I am also gaining mobility of my great toe. Next, I'm going to do side to side, and this is going to work my hip internal rotation. What I started with is a beginner way to get it. This is a larger way that I've been working towards. Whenever you do hip range of motion, if you feel pain or pinching in your hip, please stop. For all things that I'm doing, I am doing 4 to 5 repetitions. Once again, this is shown in real time. I am not fast forwarding it. Next, even though this is a hip mobility routine, I am adding in hip flexor strengthening to help me gain better motion of my hips. I am doing both sides, and I will do 5 to 10 of these leg lifts. Next, I am going to do more segmental control and more mobility for my lumbar spine, but it is a bridge. But I am also focusing on going segment by segment as I roll up and as I come down. And as I am rolling down, I am really thinking about my back kind of sagging down into a hammock to try to help me get better mobility in my lumbar spine. Once again, this is bridging, but it's also a spine mobility exercise. This is a nerve glide, a nerve mobilization. I call this ankle pumps. It is a sciatic nerve glide. It is also a variation of a dynamic hamstring stretch. So I am just pumping my ankle back and forth. I am going to probably do 2 sets of 15. That's what I normally do. And this is a nerve glide to help me have better neural tension. I am next bringing my knees to chest to kind of just rock my hips side to side and loosen up my pelvis. Next, I'm going to do posterior pelvic tilts, which is probably one of the most researched exercises in low back pain, and just really try to work on that motion of my sacrum and pelvis, really rotating backwards. Next, I am doing the most boring looking neck rolls, but once again, I am working on the control of my mobility of my neck. And so this is also a CARS, controlled articular rotation. I'll do 4 to 5 times each side, changing directions. If you do this, please do not overdo it. I don't want you to cause yourself to be lightheaded. I don't want any headaches. So next I'm going to do more thoracic CARs or spine mobility. So I'm giving myself a hug and I am dropping my chin and trying to go segment by segment. In each segment, I am trying to get that motion and then coming back up, reversing that motion. Once again, with this, we'll do this probably 4 to 5 times. So this is a thoracic car. Does it look perfect? Heck no. I'm stiff and broken just like you. But I am working on it, and I'm showing you my actual real routine. So segment by segment, going nice and slow. Now I'm going to kind of do a little knee action because, I did ankle pumps lying down. This is getting my hamstrings kind of dynamically engaged and shifting my pelvis side to side. Next, I'm going to do standing hip cars. And this is flexion. You're coming out, going back into extension. And it is difficult to do because you do have to stand on one leg and you have to control this range of motion. Some people would call this a hip opener. I just call it difficult. No, just kidding. No, seriously, it really is difficult for me to do. This is one of my greatest deficits. And you can see that I am starting to get tired. Up, I fell over. Next, we are doing scapular cars, which I show this to my patients a lot, and it really helps people with upper trap pain and headaches. And I'm going to show you from the other direction. I literally tell my patients it's like a little choo-choo train. So you have a scapular thoracic joint. So your shoulder blades attached to your thoracic spine, and it is a joint, and we need mobility. Finally, we are doing shoulder cars, and it is a gentle range of motion. Once again, 4 to 5 times, each direction, both sides. If you've seen any of my TikToks, I do not want you to have frozen shoulder. Maintaining shoulder mobility is really important as we age because I don't want frozen shoulder. If you are in perimenopause and menopause, your tissues are going to start to change. So a daily mobility routine, 10 minutes, is something that you can do. This is what I'm doing to address my deficits. Hope it helps you out. One more time, I'm doing my thoracic cars, trying to see if I gained any motion after all those neural glides. I'm not so sure I did. The end.